Hi, I'm Dr. Steffi, VS Hospital Kilpa, Casualty Medical Officer. In this video, we're just going to have a few discussion about emergencies in public places and how to handle it. So I'm just going to tell a few tips on how to handle an emergency in a public place and how you can react to it, which can be life-saving to the patient. So I'm just going to have 6 points and it will be very easier for you to remember when you see a patient like that next time. So point number 1, it is called as scene safety. So when you see a patient collapse on the road or fall unconscious, you can just move the patient from the scene to a safer place. For example, if the patient is near a water puddle or from the flight of stairs or near a fire hazard, you just have to move the patient to a more safe zone so that he'll be safer there. 2, call for help. So you have to call the patient out, or if you know the patient, you can just tap on his shoulders and say like, "Sir, are you okay? Sir, can you hear me?" So that the patient if the patient regains conscious, he'll just have a word with you or he'll just converse with you. If not, you can just call for help. That is the 3rd step. Call for help. Ask the bystanders around you to call for an ambulance. Especially, everybody around you at that situation will start to panic. So, call for help. You have to tell them to call for help. Until ambulance arrives, what are the things that you can do? First thing, check for pulse. The pulse can be checked in 2 places. One is the carotid. So this is a jawline and the carotid pulse with 2 fingers. You have to palpate here to feel for the carotid artery. Second thing, you can go for the radial pulse. Radial pulse is present just below the thumb. So you can palpate here to check for the radial pulse. Okay, what is the next step that you can do? Check for breathing. See for the chest movements, the up and rise movement, so that to see whether the patient is breathing. Okay. Third thing, look for any occlusion that is present in the mouth of the patient. You can just slowly open the mouth of the patient to see if there is any obstruction that is present inside the mouth. So you can slowly remove it. Don't try to forcefully open the mouth or remove anything from the mouth. It will cause injury to the patient. Okay. 4th step, what can be done? A quality CPR. If you know to give a CPR, that is cardiopulmonary resuscitation, or if you are BLS trained, that is basic life support training. If you have undergone all these things, you can go ahead and start a quality CPR for the patient. If not so, wait until help arrives. Okay. What can be done if a patient is having seizures? I'll just give you a few gist. If a patient is having a seizure, first thing that can be done is put the patient to a left lateral position. That is, the patient is lying flat, you can just rotate him towards left side. Okay. Second thing, do not give any sharp objects to the patient, especially keys or hard rods, anything. Do not give anything in the patient's hand. Third thing, do not try to give anything orally to the patient, like water, juice or chocolates, nothing. Nothing should be given orally to the patient until the patient is conscious. Okay. Do not try to hold the hands or legs of the patient when he is in a seizure. It will just get control on its own. So you just have to wait for some time until he regains consciousness. After the patient regains consciousness and after the patient is able to talk to you, you can give him something to eat or drink. Until that, do not give anything for the patient to eat or drink. It is just for this patient's safety so that he doesn't go into so many complications than just seizures. Okay, once you see all these patients on the road, what is the next step you can do? Once the ambulance arrives, you can give a brief history of what happened to the patient, what happened on the scene and what you have done to the patient, so that the paramedic who arrives will have a brief history of what happened 10 to 15 minutes earlier before his arrival. So, act fast and act smart.
VS Hospitals. Care, cure and compassion.